Welcome back to Microbiology. Today we are going to start our last system for Microbiology 150. This is going to cover body systems, specifically respiratory system. And so we're going to talk about microbial diseases of the respiratory system throughout this lecture. So let's start off first. With the structure of the respiratory system, the function is to exchange gases between the atmosphere and the blood. Commonly, it's going to be divided into two systems. We have what's called the upper respiratory system and the lower respiratory system. Now, in the upper respiratory system, it's going to include structures such as your nose, your nasal cavity, and the pharynx. These are going to be lined with tiny hairs and ciliated mucous membranes that are going to filter the inspired air as it comes in. So inspiration is breathing in. It's going to include things such as the sinuses, which are going to carry fluids where infecting organisms can get into it, and so we find these within that nasal cavity. So these organisms can come in through that nasal cavity and get into that mucus. It also includes the eye ducts and the auditory tubes. Eye ducts are going to carry contaminants to the pharynx, and the auditory tubes are going to carry contaminants into the pharynx and allow it to spread the contaminants from the pharynx to the ears. Another structure it's going to include is going to be the tonsils. These are going to be a conglomeration of lymphoid tissues that contain cells and chemicals that are able to combat microbes in the nasal cavity, pharynx, and auditory tubes. And lastly, what we discussed with the nasal area was going to be mucus. Mucus is going to be made by goblet cells that are going to be found in the respiratory system, and they're going to contain antimicrobial chemicals. Now, looking at the lower respiratory system, this is going to include structures such as the pharynx, which is the larynx, which is your voice box, the trachea, which is your windpipe, the bronchi, bronchioles, lungs, alveoli. All these are going to be your structures that you see there. These are going to help the air enter through the trachea into a succession of smaller and smaller branches, from the bronchi to the bronchioles to the alveoli, which are going to be the little air sacs that you're going to see within the lungs. Those are going to be where actual gas exchange is going to occur. So you see those over to the right-hand side, and you see how they kind of look like little air sacs or little bubbles. This is where actual gas exchange occurs along the respiratory membrane. Now, starting at the trachea, going down through the bronchi and bronchioles, you're going to have these structures on the cells called cilia. These are going to help to carry mucus and trap contaminants up the pharynx. So you're trying to get it up the pharynx and either be able to spit it out or up the pharynx and be able to get it into the esophagus where you can swallow it, and then it's going to go into the digestive tract where the digestive juices will destroy it. This movement is going to involve the beating of those cilia, and that's going to be known as ciliary escalator. So we have that ciliary escalator that's bringing it up, so hopefully you do one of those two things. You also have in that area called alveolar macrophages. These are going to provide microorganism defense. So these are going to be white blood cells that are going out looking for organisms that don't belong there. They'll engulf them and destroy them. And lastly, we have what's called a secretory antibody. These are going to be found in tears, saliva, and respiratory mucus, and they'll provide microorganism defense. So some normal microbiota of the respiratory system is going to depend on where they're located. So with the upper respiratory system, these normal microbiota are going to be colonized by many microorganisms. So normal microbiota are going to help to limit the growth of pathogens and maybe opportunistic pathogens themselves if you get rid of too many of the others. So ones that might not harm your body might all of a sudden start to harm your body if they have no competition. This will include things like Staphylococcus and Streptococcus species. Now, in the lower respiratory system, it's normally going to lack these microorganisms. So the first type of diseases we're going to discuss are going to be bacterial diseases of the respiratory system. Streptococcal respiratory diseases, signs and symptoms, usually they're going to have a sore throat and you're going to have difficulty swallowing. Many are going to progress into things like scarlet fever or rheumatic fever. Scarlet fever is going to be a strep throat that is going to carry a rash with it. So it carries it throughout the blood system, which causes rashes to appear throughout the body. And they have high fevers, and that's usually seen with rheumatic fever. Pathogen and virulence factors. The pathogen is going to be Streptococcus pyogenes. The virulence factor is going to be an M protein, hyaluronic acid capsule around it, a streptokinase enzyme, C5a peptidase, which is another enzyme. You're also going to have pyrogenic toxins. Pyrogens, remember, are going to cause you to have a fever, and streptolysins. And so that's going to be able to destroy cells. Pathogenesis is going to occur when normal microbiota are going to be depleted. You're going to have large inoculation introduced. And so this is going to be introduced into an adaptive immunity, and it's going to cause it to be impaired. With epidemiology, it's going to spread via respiratory droplets and occur most often in times such as winter and spring when people are more inside. Diagnosis, treatment, and prevention. So with diagnosis, it's often going to be confused with viral pharyngitis. That's going to be inflammation of the pharynx, which is going to be considered the throat. Treatment is going to be an antimicrobial drug, so it could be anything from penicillin, erythromycin, or cephalosporin. Prevention, sick individuals are going to be contagious and should stay at home. Also, wash your hands well. Next one, diphtheria. Signs and symptoms, you have a sore throat, localized pain, fever, pharyngitis, intracellular fluid that can thicken into what's called a pseudomembrane and obstruct air passageways. The pathogen and virulence factors, the pathogen is going to be Corynebacterium diphtheriae, and the virulence is a diphtheria toxin. It's going to prevent polypeptides or protein synthesis and cause cell death. Pathogenesis, bacteria is then going to be transmitted and spread via the respiratory droplets or skin contact. Symptomatic in immunocompromised or non-immune individuals. So those who have a lowered immune system are going to be severely affected and be more likely to get this. With epidemiology, it's endemic in poorer parts of the world, with 13 cases from 1997 to 2009 in the United States. Diagnosis, treatment, preventions. With diagnosis, it's going to be based on the presence of a pseudomembrane, laboratory examination through collected tissue, cultures, and immunodiffusion assays. Treatment's going to be antimicrobial drugs like penicillin and erythromycin. Also, you can take a antitoxin drug, and it may require surgery depending on the severity of the case. Prevention, we have immunizations for these. Sinusitis and otitis media. Sinusitis is going to be pain and pressure of the affected sinuses accompanied by malaise or tiredness. Otitis media is going to have severe pain in the ears. So the pathogen and virulence factors, pathogens could be Streptococcus pneumonia, Staphylococcus aureus, the Haemophilus influenza, or Moraxella catarrhalis. Virulence factors, non-applicables here. Pathogenesis, the bacteria in the pharynx are going to spread to the sinuses via the throat. Middle ears are going to be infected via auditory tubes, and inflammation is going to result from these. Epidemiology, we're going to have sinusitis. It's going to be more common in adults, and otitis media is going to be more common in children. Diagnosis is through symptoms, treatments through antimicrobial drugs like penicillin. You may be able to lance the eardrum in severe or recurrent otitis media. And prevention, no known way to prevent sinusitis. Immunization may reduce the otitis media, but it has not been given a definite proven factor for this. Next, we are going to have pneumococcal pneumonia. With this one, the signs and symptoms are going to be fevers, chills, congestion, cough, and chest pain. Also, you're going to have a short, rapid breathing, and rust-colored sputum. Pathogen and virulence factors. The pathogen is going to be Streptococcus pneumonia. Virulence factors, you're going to have adhesions, capsules, and pneumolysins that are going to occur with these cells. Pathogenesis is going to infection is going to occur by inhalation of this type of bacteria. Bacterial replication causes damage to the lungs, and then blood entering the lungs is going to cause that rust-colored sputum. Epidemiology, about 85% of all pneumonia cases are going to be this type. It occurs primarily in the fall and winter, mainly in children and the elderly. Also those who are alcohol and drug abusers, diabetics, and in AIDS patients. Diagnosis is laboratory tests. They'll do a gram stain, anti-capsular antibodies, quelling reaction, With the treatment, you're going to take an antimicrobial drug such as penicillin, cephalosporin, erythromycin, or chloramphenicol. Prevention is going to be vaccination. Signs and symptoms of primary atypical pneumonia are going to be fever, malaise, sore throat, headache, excessive sweating, and persistent coughing. The pathogen is going to be a Mycoplasma pneumonia, and virulence factors are going to be the adhesion proteins that are found here. The pathogenesis is bacteria is going to attach to cilia using cilia to stop its beating, so now it can't clear its airways. The bacteria then are going to colonize and eventually kill the epithelial cells of the respiratory tract, and that's going to cause buildup of mucus that's going to irritate that respiratory tract. Epidemiology. Bacteria is going to spread by nasal secretions. Uncommon in children under 5 and older adults. Common in children and young adults. Diagnosis, it's going to be difficult to diagnose. Mycoplasmas are going to be small and hard to detect in clinical specimens in tissue samples, so we're not going to be able to see them very well. Bacteria is going to grow very slowly in a culture, so if you try to grow it in a culture plate or agar plate, it's going to take a while. Treatment is going to be antimicrobial drugs like tetracycline and erythromycin. Prevention is going to be difficult since the infected individuals may be asymptomatic and that right now there's no vaccine available. Signs and symptoms of Klebsiella pneumonia are going to be coughing, fever, chest pain, thick and bloody sputum. Pathogen is going to be Klebsiella pneumonia, and virulence is going to be its capsule. Pathogenesis following inhalation is going to destroy the alveolar cells, producing thick, bloody sputum and recurring chills. Bacterial cell death is going to release an endotoxin that can trigger, shock, and disseminate intravascular coagulation. With the epidemiology in this, it's going to happen usually in immunocompromised individuals at the greatest risk for the infection here. Usually people who have a good immune system aren't going to be at risk as much. We see it common in the elderly, AIDS patients, and in young children. Diagnosis, we take the signs and symptoms and we take laboratory cultures. To treat this, you're going to use antimicrobial drugs like cephalosporin and aminoglycosides. Prevention is going to be good aseptic technique by healthcare workers, and at the time now we have no available vaccine. Legionnaire's disease is going to be present with fever, chills, dry non-productive cough, headache, and decreased pulmonary function. The pathogen is going to be Legionella pneumophila, and virulence factors are not known at this time. The pathogenesis, we have the Legionella-filled vesicles that are going to release into the environment via air conditioning systems, vaporizers, hot tubs, and other devices that produce aerosols. Once in the human body, that bacteria becomes intracellular parasites of the macrophages, so those are your white blood cells and of other cells. Bacteria kills human cells, causing tissue damage and inflammation. Now, the epidemiology, we have the Legionella services in domestic water sources, so they do check those at risk, are going to be the elderly, smokers, and immunocompromised individuals. Diagnosis will take a laboratory examination and fluorescent antibody staining or serology, so they look at the blood serum. Treatment's going to be antimicrobial drugs like quinolines and macrolides. Prevention is reducing bacterial presence in water and in HVAC systems. Tuberculosis. Signs are going to be mild fever, cough progression to a labored breathing, wheezing, chest pain, fatigue, weight loss, and coughing up blood. The pathogen is going to be a Mycobacterium tuberculosis. Virulence is going to be the mycelitic acid in cell walls. The pathogenesis is you're going to have the M. tuberculosis remain viable for long periods of time in aerosol. So they make little aerosol droplets that can stay in the air for a while. There's going to be 3 types of tuberculosis. You have primary tuberculosis, which involves the formation of hard nodules in the lungs called tubercles. Secondary tuberculosis, bacteria is going to rupture that tubercle and reestablish an active infection. And third, we could have the dismantling tuberculosis, where pathogens are going to be carried through the blood and lymph to various sites of macrophages. Epidemiology, of course, the immunocompromised individuals are going to be most at risk. Leading killer of HIV individuals and leading killer in Asia and Africa. Declined cases in the U.S. at the time, though. Diagnosis would be the tuberculin skin test, which is going to identify the exposure of tuberculosis. That's where they put a little bit of this underneath your skin to see if there is a reaction. Chest x-rays can identify tubercles that are going to be found in the lungs. Treatment for this is going to be antimicrobial drugs, so things such as penicillin, erythromycin, and combinations of other types of medications. Prevention, there is a vaccine available, and detect the infection, stop the spread, and ensure compliance with treatment. Next we have pertussis. This is going to initially be a cold-like symptom with a runny nose, slight cough, and mild fever. Characteristic cough is then going to develop along with vomiting, diarrhea, and choking. The pathogen here is going to be the Bordetella pertussis pathogen or bacteria. Virulence factor is that it has adhesions and several toxins. Pathogenesis is the bacteria is inhaled. Then it will progress through a 4-phase step process. First is going to be incubation, where the disease is going to be asymptomatic. Second, we have a carteral phase. This is going to last 1 to 2 weeks, where symptoms are going to be similar to the common cold. Third, you're going to have a paroxysmal phase, and that's going to last 2 to 4 weeks, where you end up with whooping cough starting. Bacteria is also going to bind to the cilia that's going to be in the respiratory tract, and that's going to interfere with ciliary escalator. Last, the 4th phase, we have the convalescent phase. That's going to last for several weeks, and that's where you start to get better and that cough starts to subside. With the epidemiology, it's going to be highly contagious. That bacteria is going to spread through the air and airborne droplets. Older children and adults may have milder infections, which are undiagnosed. You usually think that they're just a common cold. Threatening, though, in cases that occur in children younger than 5 years of age. In order to diagnose this, you take the symptoms and then you'll do a swab and isolate the bacteria in the lab. If it's found that you do have pertussis, you will have a treatment that's going to be primarily supportive. Things like antimicrobial drugs will have little effect on this. Prevention, take the DTaP vaccination. Inhalation anthrax. With this, initially it's going to resemble a cold or a flu. You'll get a sore throat, mild fever, muscle aches, mild cough, and malaise. It's going to end up progressing into a severe coughing with lethargy, shock, and even death. The pathogen for this is going to be a Bacillus anthracis. Virulence is it's going to have a capsule and anthrax toxin that's going to be released that kills cells. Pathogenesis is going to be inhalation of bacterial endospores. The endospores are going to germinate in the lungs, and vegetative cells are going to start to secrete anthrax toxins. That's going to impair the respiratory function. Epidemiology is that anthrax is not spread from person to person, but it's acquired by contact or inhalation of endospores. To diagnosis, you would have a laboratory exam that identifies the bacteria in the sputum. You could also have serological, DNA, or biochemical testing done. Treatment it has to be early and aggressive with the antimicrobial treatments. The antimicrobial drugs that would be used would be penicillin, deoxycycline, and ciprofloxacin. Prevention is going to be a vaccine that's going to be available to select individuals. So it's not a common vaccine. This one most of us have at least once a year. It's going to be the common cold. So we have sneezing, runny nose, congestion, sore throat, malaise, and cough. The pathogen for this is going to be the enterovirus, formerly the rhinovirus. So you might have heard of it called rhinovirus. Virulence factors, not applicable. The pathogenesis is going to attach to cells in the nasal mucous membranes. Then the cold virus is going to replicate and kill the infected cells. Epidemiology is going to be spread by coughing, sneezing, fomites, and person-to-person contact. Children are going to have more occurrences than younger adults and the elderly because they're constantly touching things and really close to each other. Diagnosis would be signs and symptoms and, of course, a laboratory examination if needed. When you go in to treat this, prescription drugs such as Plicanuril or over-the-counter drugs such as an antihistamine, decongestant, pain reliever, rest, and drinking lots of fluids. Prevention for this, you hear it all the time, hand washing and hand antiseptics. Antigen common to all rhinoviruses has been discovered, which may lead to a vaccine in the future. We just don't have one yet. Next, we have influenza. With this one, you have a sudden fever, pharyngitis, congestion, dry cough, malaise, malaise, and headache. The pathogen for this one is going to be the arthromyxovirus. With the arthromyxovirus, you're going to have type A's and type B's. What they're going to do, their virulence factor, is a lipid envelope with glycoprotein spikes. The pathogenesis is you're going to inhale the virus and it's going to cause damage to the lung epithelium. Epidemiology says it is transmitted through inhalation of the virus or by self-inoculation. Complications occur most often in the elderly, children, and individuals with chronic diseases. There's going to be about 200 Americans that are hospitalized with influenza, and about 30,000 are actually going to die each year. To diagnose this, you're going to look at the signs and symptoms, and you have a laboratory examination. Sometimes they use immunofluorescence. They might use the ELISA test, a polymerase chain reaction, or PCR. Commercially available rapid antigen testings are also going to be very common. Treatments are supportive care to relieve your symptoms and antiviral drugs, things like Tamiflu. Prevention, immunization with multivalent vaccines, and also make sure that you keep your hands washed. Severe acute respiratory syndrome is going to appear with high fever, shortness of breath, difficulty breathing, malaise, body aches, and later develop into a dry cough and even pneumonia. The pathogen for this is going to be the coronavirus. Its pathogenesis is that the virus is going to enter through the respiratory droplets and destroy lung cells and spread via bloodstream to heart and kidneys. Epidemiology. SARS virus is going to spread via the respiratory droplets. It affects individuals in Asia, Europe, and America, and even became a pandemic in China. To diagnosis, you look at the signs and symptoms, and you have viral isolation. Treatment's going to be a supportive treatment. You're going to take care of the symptoms and treat those. Non-antiviral drugs are also going to be effective, but a combination of no antiviral drugs, are going to be effective with this, but you're going to have a combination of steroids and antiviral interferon may be effective. Prevention is going to be limiting travel time and to endemic areas, hand washing, and quarantine infected persons and contacts. Respiratory syncytial virus, or RSV. Signs and symptoms of this is going to be fever, runny nose, and coughing in babies or immunocompromised individuals. Usually it's going to have mild cold-like symptoms in older children and adults. The pathogen is going to be the respiratory syncytial virus, or RSV. Pathogenesis is it cause the syncytia to form in the lungs. This is going to be giant multinucleated cells that are going to be formed from the fusion of virally infected cells to neighboring cells. Mucus, fibrin, and dead cells in the bronchioles are going to make it hard to breathe. Immune response to RSV is going to cause further damage to the lungs. With the epidemiology, it says the transmission is going to occur via close contact with infected people. It affects immunocompromised and elderly, and infants especially. 98% of children in daycare are going to be infected by the age of 3, so it's fairly common. It kills about 14,000 elderly each year, though. So to diagnosis, you're going to have respiratory distress and laboratory examinations, which are going to look at immunoassays, nucleic acid probe analysis, and you can use the ELISA test. To treat it, there's no treatment for older children and most adults. Most of the time they get well on their own. Younger children can have supportive treatments that are going to support their breathing, like oxygen, IV fluids. They can have fever-reducing drugs and antibiotics. In severe cases, administration of immunoglobulins. So those are going to usually come from serums that have been taken from people who have had this illness. Prevention, aseptic technique to healthcare and daycare employees, so make sure that everything's washed up and cleaned, as well as hands. No vaccines available at this time. Hantavirus pulmonary syndrome. Signs with this is going to be, with early symptoms, you're going to have fever, fatigue, muscle aches, headache, chills, nausea, vomiting, diarrhea, and even abdominal pain. The symptoms will progress to a cough, eventually into shock and labored breathing. The pathogen here is going to be the hantavirus. Pathogenesis is upon being inhaled into the body. That virus is going to enter the blood and travel throughout the body, infecting cells that make up the blood capillary walls and the lungs. Infection's then going to cause like a widespread inflammation, which can lead to shock. Epidemiology. So human disease more likely as mouse populations increase. Person-to-person contact does not occur, and transmission via inhalation of dried mouse urine, feces, or saliva could occur. Now, in order to diagnose this, they're going to look at the signs and symptoms, and they're going to go with laboratory examinations. To treat it, they usually just have supportive treatments. You have pulmonary intubation, fever-reducing drugs, pain medications, and supplemental oxygens needed sometimes. At the moment, we do not have a vaccine to prevent this, but we strongly suggest avoid rodent droppings, campground sheets if you're camping. Carefully clean out potential rodent nesting sites at home, and keep your home clean in general. Now we're going into mycosis of respiratory systems. We have coccidiosis mycosis. This is going to resemble pneumonia or tuberculosis. In severe cases, you'll have fever, cough, chest pain, difficulty breathing, coughing up or spitting up blood, headaches, night sweats, weight loss, and trunk rashes. It can become systemic in immunocompromised people. It may result in meningitis, headache, nausea, and emotional disturbance. So the pathogen here is going to be the coccidiosis immitis. Its virulence factor is going to be spores. So with the pathogenesis, the fungus is going to enter through inhalation of spores from the soil, and diseases are going to start in the pulmonary infection area within the lungs, and then spread to the rest of the body. Epidemiology, it's exclusively in southwestern United States and northern New Mexico. Small endemic areas in Central and South America, and any activity disrupting soil disseminating these spores. To diagnosis, you're going to look for the presence of the spiracles in the clinical specimens. To treat it, you're going to use antifungal drugs. Prevention is going to be protective masks, which can prevent exposure to these spores when the soil is turned up or disturbed. Blastomycosis. With this one, you're going to have flu-like symptoms, systemic infections like lesions on the face and upper body of the pus-filled or purulent lesions on organs. The pathogen is going to be the blastomyces dermatitis. The virulence factor is going to be spores. So with the pathogenesis, the fungus is going to enter through inhalation of dust carrying these fungal spores, and is going to infect the lungs. The spores then are going to germinate there to form yeast. Epidemiology, you're going to have an incidence of human infection increasing, reported mainly in places like Latin America, Africa, Asia, and Europe. Mortality is going to be high among the immunocompromised patients, and it's often common to have a relapse. To diagnosis, the fungus is going to be identified in clinical samples and microscopic examination. If you're going to treat it, you need antifungal drugs like amphotericin B or different oral medications that are going to be antifungal medications. To prevent this, you have recombinant DNA vaccines that are provided for protection in areas with mice, and no vaccine is going to be available though with humans, so they have found one in mice. Histoplasmosis. It's asymptomatic in most cases. Symptomatic infection is going to cause coughing with body sputum or skin lesions. The pathogen is going to be Histoplasmosis capsulatum, and it's going to infect using spores. Pathogenesis is going to be fungal spores being inhaled from the soil, and it's going to attack the alveolar macrophages in the lungs. Epidemiology, it says it's prevalent in the eastern United States along the Ohio River Valley. It's an endemic in Africa, Central, and South America. To diagnosis, the fungus is going to be identified in clinical samples and treated with antifungal drugs. Also, immunocompetent individuals sometimes can resolve without treatment. It's just dependent upon each case. So to prevent it, you will minimize your exposure to soil, especially near chicken crops, bat caves, and if you have to be near those areas, make sure to wear a mask and to wash your hands well. And our last one for the respiratory system is going to be pneumocystis pneumonia. So with this one, it's going to have a difficulty breathing, anemia, hypoxia, fever, and a non-productive cough. The pathogen in this case is going to be Pneumocystis jirovecii. The pathogenesis is transmission that's going to occur by inhalation of droplets that contain the fungus. Once in the lungs, that fungus is going to multiply rapidly and extensively colonize the lungs. Epidemiology, it has been observed in malnourished premature infants and in the weakened elderly patients. It's also going to be commonly found in AIDS patients. About 75% of healthy children have been exposed to this fungus by the age of 5. So with normal people, it does not cause a lot of problems. Now, in order to diagnose this, you would have a clinical and microscopic diagnosis. You also would look at chest x-rays that may reveal abnormal lung features and fluorescent antibodies. In order to treat this, you would use antimicrobial drug combinations. And to prevent it, it is almost impossible to prevent, but things that might help would be to stop smoking if you smoke, make sure that you have good nutrition, and HIV infection prevention. Okay, so this is going to finish us up for respiratory illnesses. I will see you back here and we'll discuss microbial diseases of the digestive system.